Hello everybody. Today my video is to answer the question of whether to use orthodontics, which is placing of the brackets, or aligners to correct and straighten the teeth and correct the occlusion, or the use of prosthodontics, which uses ceramics to have a straight beautiful smile. This question is more to people that are above 18 years old or directed to adult orthodontics. In general, why do people try to run away from orthodontics? They don't usually want to do orthodontics because they don't want to put brackets on their teeth. They don't want to have restriction of eating, restriction of hygiene, or committing to a long treatment period, which is around 6 months, 8 months, and the average is around 2 years. On the other hand, they prefer to do prosthodontics, which is placing veneers on their teeth, or placing crowns, which can be done in 1 to 2 weeks. So why to go into orthodontics? Number one, orthodontics, they treated orthodontics treated the problem of having brackets that are apparent from outside. Now we have what is called the lingual orthodontics. Lingual orthodontics is placing the brackets from the inside of the tooth, which is the actual invisible orthodontics. This can treat your problem. You can have a straight teeth exactly as the normal labial brackets, but without anybody noticing a bracket, without you seeing any brackets from the outside. And together we have the option of the clear aligners that is more advised for cases with less occlusal problems. The second thing that people try to avoid orthodontics for is that committing to 2 years program or a 1 year program. Yes, we are committing to a 2 year program, and we are obliged to visit the orthodontist every 5 weeks, every month, one time, which is not a long period of visits during the 2 years, but it is a commitment. But at the end of this commitment, you're having a lifetime, a long-term, natural, beautiful smile that you worked hard for it for this 1 or 2 years. And the same for the hygienic procedures. Yes, we're taking care about what we eat, how to clean our teeth, to clean after each meal, but this will at the end give you a long-term result, a lifetime smile that if you take care with it with the simple procedures, cleaning 2 or 3 times every day, going to the dentist every 6 months, you guarantee to have this teeth, this occlusion, this smile for the longest possible period or for a lifetime period. On the other hand, using prosthodontics, whether veneers or crowns, starting from 0.5 millimeter, which is the least invasive prosthodontic procedure using the veneers or lumineers, to using to full crown, which is cutting, which needs or requires cutting of 1/3 or half of your crown. You're doing irreversible damage for your tooth. You're doing irreversible loss of a tooth material that in no way you can return it to your tooth. The other thing is that this hygienic routine during the use of veneers and crowns, this is a lifetime routine that you should be committed to when having veneers and crowns, because once you neglect your hygiene, you neglect your regular dental visits, you start having gingivitis, bleeding gum, halitosis, which is a bad smell. So you're having a lifetime commitment to hygiene process. The third thing is that in orthodontics, yes, we take care about our food and what to eat not to eat gum, not to eat sticky things for a period of, let's say, 2 years. But with crowns and veneers, taking care of what to eat is also a lifetime process, because ceramics are really strong, but they are brittle. They can be broken if a sudden impact is subjected to them. Together with the fact that anything artificial we put in our teeth, in the maximum best circumstances, after 10, 15 years, let's say 20 years, rehabilitation should be done. Changing of some of the crowns, changing of the some of the veneers should be done, because nobody is perfect in the way of cleaning and brushing and taking care about this. So looking forward for a natural, beautiful smile with the natural elements that are already present in your mouth is usually a better option than cutting from your teeth, shortening the lifetime of your tooth, and placing an artificial material that needs a long-term maintenance. I hope my video answers some of your questions, and I'd be happy to answer any questions when you'd love to ask. Have a good day. Thank you.